the headlines, the Ministry of Health discusses Belize's response plan to the novel coronavirus, and the Mesoamerican Report Card reveals that Belize's barrier reef health is improving. These stories and more on this week's edition of Belize Now. Thanks for joining us on this Friday, February 14th, 2020. I am Erin Guzman. This week, the Ministry of Health held a press conference to share their response plan to the novel coronavirus, now known as COVID-19. The purpose of the press conference was to address concerns presented by the public, acknowledge the information that is currently being spread that could be causing panic, and highlight the work being done on the ground and behind the scenes that the public may not be aware of.
The amount of information that's coming to us is significant, but at Health I think we have been trying to funnel that information. Whatever information trickles back to the regions, and whatever information comes from outside to the regions has to have one person that goes through that, because then you get bombarded with all of that. We don't really get our information from the headlines of newspapers. I can tell you that, because that's the first thing that gets flagged to us. We will go to reliable scientific data.
So the following is what we have been gathering from WHO. On January 7th, 2020, Chinese authorities identified a new type of coronavirus, which is now termed COVID-19, from a cluster of pneumonia cases in Wuhan City, Hubei province in China. It is a new strain of coronavirus and has not been previously identified in humans. There was an initial case to have thought that it was linked to a human sea market in that city. However, there is still, as we had mentioned, ongoing studies and investigations that are probably alluding to something else. There is now evidence, though, that there is human-to-human transmission. Globally, all cases have had a history to Wuhan and China, or have had a close contact with a confirmed case. On the 30th of January, WHO Director General declared the outbreak of COVID-19 a public health emergency of international concern. And to date, we have 24 countries that now have ongoing transmission. What is likely is that exported cases of COVID-19 are expected to occur, particularly with the degree of mobilization and travel. We do know that it is a novel strain of the coronavirus. They all belong to the coronavirus family. This is a novel strain. That means that we have not built any immunity towards this new virus, and the reason why it is being seen this way. We also are seeing what in certain populations being affected. So when you look at children, the pediatric population under 5, they're the ones affected, and we also look at those that are over 65. Of course, we do understand that these two opposite scenarios are those that are immunocompromised or their immunity is still building.
The Ministry of Health has based its national response on initial assessments. At this current point in time, the response plan is at the preparatory phase because there are no confirmed cases of COVID-19 in Belize.
Because our biggest port of entry is the Philip Golson International Airport, Central Health Region immediately took action, looked at their plan, and started to implement certain measures at that point. So enhanced surveillance in regards to ports of entry is one of the areas. We do have ongoing surveillance for influenza-like illnesses, and our laboratory has increased its capacity to detect a wider panel of pathogens. So in the event that we detect a suspected case that requires that level of screening, because we must understand that there is a case definition. There are certain criteria that have to be met for this screening to actually happen. For us at surveillance, we look at every rumor that is out there. So any information that comes to us, whether it's official or unofficial, through social media, through a neighbor, through somebody, we investigate. We do not take it lightly. I must say at the Philip Golson International Airport, all passengers are being screened, and when I say screen, I mean for us as health, we have certain tools that are applied to identify whether that person is a person of interest.
At the regional level, the PAHO director, Dr. Carissa Etienne, has been in close contact with ministers of health. We have been sharing information, and we have been having coordination meetings with the Ministry of Health, and our PAHO Rachel representative in Belize had been in touch very closely with the Ministry of Health, including DHS. We've had several meetings already taking in place. We are having a training on in Mexico to increase capacity on the identification of the virus itself, and hopefully today it ends, and when they all come back tomorrow, Belize would have the capacity to detect the virus in country. We have a very informative web page that provides the measures that individuals and public must institute in this time of the crisis. We are here to assist the Ministry of Health, and we are continuing our gathering of information as well, and there are still a lot of unknowns that are being investigated, and we hope that some of the concerns that especially the ones who are investigating the virus would have the answers.
The Ministry of Health reminds the public that the best way to reduce the spread of viruses, including COVID-19, and minimizing infection is by practicing proper hand-washing hygiene, covering the nose and mouth when coughing and sneezing, and avoiding contact with anyone with cold or flu-like symptoms. We'll have more on this next week. We'll have more stories after the break. Stay with us.
The Belize Billing Act was amended in 2017 to clarify and strengthen the relationship between the Central Billing Authority, the councils, and the municipal billing authorities. The implementation of the provisions of the reformed Belize Billing Act has led to the establishment of a billing unit in each municipality. This structure has been put in place to facilitate and make efficient the permitting process for building construction, demolition, and occupancy within each municipality. All 9 municipalities have an established and certified billing unit, which is the sole billing authority at the municipal level. Prospective applicants in the different municipalities who wish to apply shall submit their application to the billing unit within their respective towns or cities. This message is brought to you by the Building Sector Reform Project at the Ministry of Housing and Urban Development, the Central Billing Authority, the Ministry of Local Government, and the Economic Development Council.
The Mesoamerican Barrier Reef is the largest reef in the Western Hemisphere and stretches across Mexico, Belize, Guatemala, and Honduras. The Mesoamerican Reef Report Card is a reporting tool that guides the management of reef systems and is a way to inform the public on the state of the barrier reef. The report card was launched on February 13, 2020, and while it showed an overall deterioration of the barrier reef ecosystem for the first time in 12 years, it also showed the health of Belize's barrier reef has improved. Belize now has the highest reef index of the Mesoamerican Reef, a 3 out of 5. Melanie McField, Director, Healthy Reefs for Healthy People Initiative with the Smithsonian Institution, explained what contributed to this ranking.
We saw an increase in parrotfish and the herbivorous fish biomass, which we protected them in 2009, and it just has taken a while for those populations to increase. And so now they are doing their job, which is reducing macroalgae, which is the other improvement that we measured. We actually have a slight decrease in this fleshy macroalgae that tends to overgrow the reef. So those are two really good things. The coral cover inched up a tiny little bit, so it didn't have a problem.
The collaborative efforts of all stakeholders have been recognized as a contributing factor to the improvement of Belize's reef. The government of Belize, of course, plays a key role in the work of protecting the reef. we spoke to Beverly Wade of the Fisheries Department.
The government, along with partners, have also been very proactive with increasing our space that is currently under protection. Actually, Belize is one of the countries that have actually met the goals under the Convention for Biological Diversity, and also under the UN Oceans Summit that is now saying that at the end of the day we would want to see 20% of your territorial waters under protection, and Belize have now above that. We have approximately 23% that are protected areas. Government has already made a policy decision that it will now look at putting in new legislation that will increase our current no-take zones that are currently around 7% of our territorial waters to the 10% that is now being prescribed under the SDGs. What we now have to do is to now invest and ensure that they're effectively employed, they're effectively applied, and at the end of the day that we can continue to work along with the users, with partners like Healthy Reef to monitor and to see where we could continue make interventions. Remember, our barrier reef system in Belize, it's said to contribute in excess of $1 billion to our national economy annually. And if for a small developing country, that is significant.
Despite the increase in the health of Belize's reef system, there are still some concerns, including the replenishment of commercial fish and the presence of macroalgae.
The commercial fish is kind of stable and dropping. So the commercial fish is the thing that for Belize we still need to work on. So, and that I think, the main recommendation that we have is these replenishment zones. You need areas of the reef that you do not fish. I think it's really important that people remember like those seasons, the close seasons and the size limits for all the seafood products. They're there for a reason.
In the report card, we talked about a crab herbivory project that we're running. Essentially, the Caribbean crab, which is a very large crab that lives on our reef, is a herbivore. And so as we're identifying that the macroalgae problem is becoming extensive, we need to address it somehow. So the first part of that was the parrotfish ban that I'm sure you talked about earlier, but then we want to be able to help the situation by providing even more herbivores. One of the other side effects, I guess, positive side effects of this project is actually being able to help fishermen find additional income. So once we work through the process of how to raise the crabs, we will be able to pass that knowledge on to fishermen. And we would like to essentially strike a deal that if you learn how to grow these crabs, maybe 20 or 30% you put back on the reef, and the remaining percentage is yours for you to sell to earn income. So it benefits both the reef and both livelihoods.
The Mesoamerican Reef Report Card covers 286 sites along the reef. 104 of those areas are within Belize's reef system. The lobster season will be closed as of tomorrow, February 15th, and it will remain closed until midnight of June 14th, 2020. Any person found in possession of lobster during the closed season will be prosecuted. The Fisheries Department reminds fishers that lobster traps should be removed from fishing grounds during the closed fishing season. The department will be actively enforcing the removal of traps from the waters during this period. The public is advised to report any illegal fisheries activity by calling telephone number 224-4552 or 203-2623 or by email fisheries_department@fisheries.gov.bz. Stay tuned for more stories after the break.
Construction of the Airport Link Road is near completion and promises exciting benefits to the country. The works feature 5 miles of climate-resilient road, construction of a world-class high-rise bridge over the Belize River, and 2 3-leg roundabouts. This Airport Link Road will create new, convenient access to the airport from the George Price Highway, saving commuters time and money. Additional benefits of the new road includes a reliable and prompt detour in the event of a disaster on or near the Hullover Bridge, creation of access to thousands of acres of land that can be used for housing, agriculture, or commercial purposes, and alleviation of some of the traffic congestions in the outskirts of Belize City. The road is being built by Cisco Construction, one of the leading road developers in the Caribbean. More for Belizeans, more for Belize. The government of Belize, moving Belize forward.
In September of last year, the National Forensic Science Service held Belize's first National Forensic Science Symposium. Our team worked with the Forensic Department to create a 3-part documentary series for that symposium, which highlighted the work of the department. Here is the first part of that series.
The Scenes of Crime Unit was established in 2004 under the command of the Belize Police Department. However, in 2013, the unit, along with the Medical Examiners Unit, was amalgamated under the management of the National Forensic Science Services.
The idea to make them separate from the Police Department is to try to promote objectivity of analysis and try to mitigate against the perception that the Forensics Department is working solely for the police side or the prosecution side of cases.
The unit is headquartered at the Queen Street Police Station compound in Belize City. There is a branch of the unit countrywide at all major police stations.
We have senior crime scene technicians for the Scenes of Crime Unit. That we have 5 of them. One is responsible for northern Belize, one for western, one for southern, and 2 for the eastern division.
Ashanti Guzman is the Assistant Director of the Scenes of Crime Unit. She told us briefly about her role.
My role is to execute the goals and functions of the unit, implement policy changes, ensure that policies and procedures are carried out in an effective way, as well as liaise with the other assistant directors for the department to ensure compliance with policies and procedures which are done in an effective and timely manner.
Currently, there are 31 crime scene technicians at different levels. These are the public officers you would spot at a crime scene along with the police officers.
Some of the offices have as little as 1 personnel working out of it. Some offices have up to about 10 or 11 personnel on shift working out of that office. Belize City office is the only office that is manned 24/7 on a shift basis. The other offices are manned 8 to 5, and after hours it's on an on-call basis.
Crime scene technicians have varying degrees of responsibilities. They're primarily responsible for processing the crime scene. The processing involving collecting evidence from crime scenes, which include packaging, proper labeling, sealing, and transporting these exhibits from these crime scenes and handed over to the case investigating officer or transported to the forensic laboratory for analysis.
So what does it take to become a crime scene technician?
The person must have at least an associate's degree in some kind of natural science, biology, chemistry, or any related fields such as criminal justice or criminology. No years experience is required, but if the person do have background in crime scene processing, that will be an asset.
Here we have the Scenes of Crime Mobile, which the Scenes of Crime Unit process crime scenes in the city. The first thing we have here is our metal detector. This is used mostly when we are processing shooting. We go and try to see if we could find slugs or shells or so forth on a crime scene. This here is our biofoam. This is for impression purposes. If you could put your hand on and just press on it, and you'll see that you could move it now. What we do, we collect the prints from personnel, or we usually use it for footprints on the crime scene. When let's say we find a person of suspect, then we let them stand on the foam, and then their shoe print will leave there, and so we could match it with the prints we left out from the crime scene.
Use this over again?
No, once we use it, that's it.
That's it. Okay.
Yes, ma'am. Here we have our famous crime scene barrier tape, which we use at all crime scenes. So when there is a crime, we have things that we call the barrier. We have 2 types of barrier. We have the cordon, which we cordon off the crime scene so that nobody can go in there and contaminate the crime scene. And once you see this crime scene by a tape of the crime scene, that nobody should enter under the crime scene, because that's the area we suspect the crime had occurred, and so that's where we will be searching for all our evidence and exhibits there on the crime scene. Again, once we found an exhibit, then we number them with our indicators. We have indicators from 1 to 50. So whenever you see an indicator there, simply means there is an exhibit or an evidence there. All right, and over this side we have the UV lights. We usually use UV lights for sexual assaults or for looking for small objects. For example, semen, blood, saliva, and then whatever we use the light, we use it along with the goggles, and only with the goggles you could see what this is showing. And then we have our fingerprint kit here, which we dust for all fingerprints on the crime scene. We have magnetic, we have conventional fingerprint powders. And we have our brush, which we brush our fingerprints. And that's it for this truck. Inside the truck also have generators, it have coolers, it have first responders crime scene kit, which we have all the equipment we need to process any crime scene in Belize City or countrywide. We also have our body bags for the purpose of transporting bodies from the scene to the hospital or to the morgue. Okay. And we also have other equipments in here, which we use at all crime scenes. The scenes of crime technicians also use their protective gears when they go to the crime scene.
As you can see, the technicians carry out various tasks, including lifting latent prints from crime scenes when necessary. When they do this, they require the use of the AFIS, the Automated Fingerprint Identification System, which is used to identify latent prints.
I am one of 4 fingerprint expert analysts in the country of Belize, and what I would do is analyze these prints against a database of convicted persons. And if we get a match in that database, then I would do a manual comparison, and then I would take it to court. If there is no match in the system, sometimes they would have suspects, people that were seen leaving the area or seen with items or articles from that area. We would get those persons' prints and we would run it against the latent prints found at the crime scene. Previously, when we used to do manual comparison, it was only able to be done against suspects. But now that we have the AFIS, which is an automated computerized fingerprint system, we can check against a database of thousands.
Both the Belize Police Department and the court depend on the functions of the Scenes of Crime Unit. The outputs of the Forensics Department can be used by either the prosecution or the defense. An important part of their job is to give expert witness testimony in court in reference to their crime scene processing.
They provide a very essential service for us, which police used to do before, but now it is on their hands. We depend a lot on them when it comes to the processing of scene, collecting, packaging, and transporting of evidence that are actually left on the scene and they need to be analyzed at the lab. We communicate with the scenes of crime technician and the investigator. They are having meetings in regards to different scenes that they attend and how to best improve the scenes.
The Scenes of Crime Unit effectively carry out its duties. However, the need for improved office spaces countrywide has become a priority for the department. The Forensics Department is working on a project to prioritize which offices are in need of new spaces. Very important is to have an appropriate area for the technicians to manage exhibits from crime scenes.
Basically what needs to happen is each Scenes of Crime office needs to have a technical workspace that they can handle those exhibits, and also an office space area where they can actually write reports, conduct meetings, conduct trainings, etc. Of course, in Belize City, because they're on 24/7 duty, a lot of them, or some technicians are on shift during the night, during the early hours of the morning. We do have to accommodate rest quarters, sleeping quarters for staff. So there needs to be a push for us, and there is a push, like I said, to invest in upgraded work areas, office areas, and resting quarters for staff for scenes of crime.
The plans for the department are hoped to come to fruition within the next few years. In the meantime, the Scenes of Crime unit continues to dedicate their service to Belize.
And that's it for this edition of Belize Now. If you want to provide feedback or send in your comments, please feel free to email us at info@pressoffice.gov.bz or visit our Facebook page and let us know what you think. We look forward to hearing from you. From all of us here, have a great week. Until next time.